pandemic is still making headlines, of course, as the U.S. sees its biggest surge since the start of the pandemic.
Yeah, it's time to get our weekly check-in with Dr. Zorba Pastor. Zorba, good to see you.
Good to see you guys.
A lot of people have been having questions about the safety of going to gyms. You know, everybody's kind of excited at first when the gyms opened up, but now maybe not so excited. They got to wear masks. And what are your thoughts as they try to do this?
Well, you know, first of all, if you're even thinking about going to the gym, you have to look at your risk factors. So if you're a diabetic, if you have heart disease, if you're over the age of 65, you obviously have risk factors for COVID. So the idea of exercising close to somebody else really becomes a very, very problematic thing, really becomes something that's very difficult. The second thing is, if you're going to go to a gym, you really want to make sure that they're looking at social distancing. Now, that's hard to do if you're in a class. I can't imagine a class with social distancing unless they actually take and make sure people stay in a certain spot and they social distance, because we know that that's the #1 thing to keep the spread from happening. It's not just the mask. The mask is minimal. Social distancing is maximal. And then the final thing is you want to know whether or not your gym is actually scrubbing things down. Are they actually wiping things down afterwards? Are they actually taking care? Are people actually wearing a mask when they're exercising? Because that's the way we have to do it. And frankly, this is the new normal until we have a vaccine, and the earliest a vaccine is going to be here, in my judgment, is probably a year from now. So we have to adjust and figure out how to do this in a safe manner.
We're going to be taking your calls in just a little while. Zorba, do you think you should be wearing a mask whenever you exercise, indoors or outdoors? Like if you're running, should you be running with a mask on?
You know, I think if you're running and you're just sort of running down the street, you're not near people, I don't think you really have to wear a mask. Once again, as long as you're 6 feet away from people, you're for the most part not going to spread it. On the other hand, if you're running and you feel like you're going to be close to people, let's say down the bike path in Madison and there are lots of people running, then a mask is the best way to do it. And frankly, I've exercised when I'm, you know, if I'm exercising, I'm wearing a lightweight mask. I don't find it that difficult. Do I sweat more? Yes. But on the other hand, when I sweat more, I feel like I'm actually doing more. I may not be doing more, but I feel like I'm doing more. So I think it's okay. Once again, if you're going to err on the side of safety, just like we put on our seatbelts, we're on the side of safety. And I think the important thing, as you know, in every county, it is not required to wear a mask. But if you're intelligent, if you're smart, if you're polite, wear a mask. Just like you wash your hands after you go to the toilet, put a mask on, save other people's lives.
Yeah, if we start doing this, you know, and stick with it, now they're saying, you know, maybe at the beginning they said, oh, we don't need to wear masks. Now maybe people are going to, you know, we keep learning more things about what's going to work, right?
Right. Science is messy. That's the way it is. If everyone in the U.S. put on a mask, we would tamp down the epidemic and we would keep it down in the pandemic, and we would keep it down until we finally had an immunization. But the reality is, unfortunately, politics has entered into this, but the reality is, be a good citizen, wear a mask.
All right, very good. If you have a question for Dr. Zorba Pastor, now is the time to call in. The number is 270-9933. Zorba, stand by just a little bit. We'll have a quick break, and when we come back, we'll take your calls. So call now if you have a question.